NABH Clinical Audit is an essential component of the accreditation process that focuses on evaluating and improving the clinical practices and patient care outcomes in healthcare organizations. While I cannot provide a full detailed session on NABH Clinical Audit, I can provide you with an overview of the key elements involved in the process. It's important to note that specific requirements and guidelines may vary based on the latest edition of NABH standards and any updates made by the organization. Purpose of clinical audit: to assess the clinical performance of healthcare organizations, to identify areas of improvement in patient care and safety, to monitor compliance with clinical protocols, guidelines, and best practices, to ensure continuous quality improvement in clinical outcomes. Scope of clinical audit: clinical processes, protocols, and practices across various departments. Patient care outcomes and performance indicators. Adherence to national, international clinical guidelines and protocols. Medication management and patient safety practices. Infection control practices. Documentation and medical records management. Clinical audit process: selection of clinical areas and topics for audit. Development of audit criteria, indicators, and data collection tools. Data collection and analysis. Identification of gaps and areas for improvement. Development and implementation of action plans. Monitoring and review of progress. Key components of clinical audit. Clinical governance: establishing a framework for clinical accountability, responsibility, and oversight. Clinical indicators: developing measurable indicators to assess clinical performance and outcomes. Data collection and analysis: collecting relevant data, analyzing it, and comparing it against established benchmarks. Clinical Audit Committee: establishing a committee responsible for overseeing the clinical audit process. Action plans: developing strategies and interventions to address identified gaps and improve clinical practices. Monitoring and review: regularly monitoring and reviewing the progress of action plans and their impact on clinical outcomes. It's important to note that the specific requirements and details of the NABH clinical audit process may evolve over time, so it's recommended to refer to the latest edition of the NABH standards, guidelines, and official resources for the most accurate and up-to-date information.